the promotion of high-quality health care, a universal concern that encompasses every facet of medical practice. It is a process of probing the complexities of human physiology and responding with methods of diagnosis and treatment that are equally complex and progressively sophisticated. Toward this end, the implementation of high-quality standards is of paramount importance, and the science of pathology stands in the pivotal position. The pathologist's role in the clinical laboratory is the key to investigation, diagnosis, even treatment. And as such, pathology is the watchword of high-quality laboratory performance. Supporting and sustaining these standards of quality is the College of American Pathologists Laboratory Accreditation Program. Through voluntary participation in this program, laboratories can receive thorough assessment and consultation in all areas related to pathology. Laying the groundwork for accuracy and reliability, the college's program sets in place a system of controls for optimum laboratory performance, where the actions of people, equipment, and materials are constantly monitored and verified. The College of American Pathologists Laboratory Accreditation Program continuously seeks excellence by establishing the highest standards for laboratory practice. During the process of accreditation, the entire laboratory is inspected and checked against these carefully determined norms and standards. As a major aspect of the accreditation program, each laboratory receives an assortment of comprehensive proficiency surveys. These surveys function as quality control evaluations for laboratory accuracy, whereby laboratory personnel perform tests and record results for samples provided through the program. The laboratory is a complex system, and pathology is its most integral resource. The value of laboratory accreditation is directly linked to the valuable functions of pathology as a whole. Heading the clinical laboratory team, the pathologist orchestrates the diagnosis and treatment scenario directed to the proper care of patients. The pathologist director of the laboratory has a primary responsibility to assure the medical validity and usefulness of all laboratory data. As a medical laboratory specialist, he assists the medical staff in correlating and interpreting this data in concise and relevant form. In today's changing healthcare environment, the pathologist is truly a crucial safeguard toward high-quality, cost-effective laboratory performance. The science and practice of pathology is divided into two sub-sciences, which are distinct yet often interrelated. Anatomic pathology involves the study and analysis of surgical or biopsied specimens. In an operating environment, when time is of the essence, the pathologist can diagnose specimens quickly and accurately by freezing and analyzing thin slices of tissue. He is equipped to isolate and differentiate cells through rapid cell staining and analysis. The anatomic pathologist is indeed an important medical consultant under even the most intensive surgical conditions. Of equal significance is the special field of clinical pathology. This is a diverse and highly specialized area of laboratory science that spans a broad range of medical expertise, such as hematology, which deals with blood cell functions, blood disorders, and coagulation abnormalities. Microbiology, the isolation and identification of infectious disease agents and appropriate antimicrobial therapy. Blood banking, an intricate process of screening, cross-matching, and monitoring blood for transfusions. And immunology, a relative newcomer in laboratory medicine, involving the study of immunity and immune responses to disease. Clinical pathology is a timely and formidable agent in the continued fight against life-threatening illnesses. Together with anatomic pathology, it brings to the laboratory the indispensable resources of true medical consultants, whose procedures warrant consistent monitoring of materials, equipment, and personnel. The College of American Pathologists' Laboratory Accreditation Program is widely respected in its capacity to foster and recognize such consistency. It is a program as sophisticated as the science for which it was designed. At a college accreditation site visit, the pathologist inspector introduces members of the inspection team. In addition to the pathologist who heads the team, the group may include other pathologists, section supervisors, medical technologists, and masters and doctorally prepared clinical scientists. The administrator of the facility is asked about the administration of the laboratory as a department of the hospital. The contributions of the pathologist and his staff are reviewed regarding educational programming inside and outside the laboratory. In a meeting with the pathologist team leader, a representative of the medical staff explores the pathologist's role as a problem solver and clinical consultant. The next step of the inspection involves an in-depth review of each department of the laboratory. More than 3,000 questions are asked to identify problem areas in the entire laboratory. Quality control measures are reviewed to assure the effectiveness of reagents. The inspector verifies that stock cultures with known reactions are available to check media for its ability to support growth. Anatomical stains are also checked for quality. Attention to detail is absolute, and safeguards are established within exacting specifications. Laboratory equipment is examined as well. Daily quality control checks and preventive maintenance schedules for all equipment and crucial data processing systems must be documented. Often, specialized testing procedures are required for a variety of sophisticated methods and equipment, many of these in the area of chemistry. Appropriate controls must be in effect to ensure accurate results. Multi-channeled autoanalyzers, flow cytometers, automated hematology and microbiology. These are some of the advanced methods which undergo a review of the highest caliber. In a final summation conference, the accreditation team reviews its findings with the laboratory staff and answers questions as they arise. Only the laboratories that maintain the highest quality standards receive accreditation through the college's program. It is a valuable seal of approval that stands for superior performance in the science of pathology and ultimately for excellence in patient care. The Laboratory Accreditation Program of the College of American Pathologists is strategically geared to this goal of excellence. Pathology is a science involving the entire spectrum of patient care, from behind-the-scenes laboratory expertise to the personal assurance of safety and well-being. Some 3,600 select laboratories have been accredited by the College of American Pathologists' Laboratory Accreditation Program. Through quality standards designed and applied toward the betterment of pathology, a pivotal aid to medical science in the never-ending search for excellence.